Welcome to EuroPCR 2016 and welcome to an interview, a discussion about extra-renal intervention in hypertension. With me here are Professor Kostas Tsioufis, interventional cardiologist, University of Athens in Greece. Hello, Kostas. And also Professor Pathak, clinical pharmacologist and cardiologist at Clinique Pasteur in Toulouse, France.
Hi,
Atul,
Felix.
welcome.
Thank you.
We will discuss a couple of new and innovative approaches to treat hypertension beyond renal denervation, and we will start with an area, a region of interest, which is indeed the carotid artery. Atul, could you comment on what is ongoing in the field of carotid interventions with respect to hypertension?
Yeah, I mean, the carotid artery is a very fascinating area to treat hypertensive patients. There are basically three approaches. The first one, called baroreflex activation therapy, where basically a device will try to stimulate baroreceptors located at the level of the carotid artery, and by doing this, inducing a physiological expected response leading to a blood pressure reduction through sympathetic inhibition and parasympathetic activation. The second strategy is basically to modify the architecture of the carotid artery by the use of a stent, which will modify the diameter of the artery, and by stretching the baroreceptors, somehow do exactly the same thing as baroreflex activation therapy.
Without the stimulator, right?
Without the stimulator, exactly. And finally, the third option would be to play not on baroreceptor, but to play on other receptors, which are called chemoreceptors. To make it very simple, when you are experiencing hypoxia or hypercapnia, you will stimulate these receptors and they will lead to sympathoexcitation. So one strategy is a kind of surgical approach. By the means of ablation of carotid body, you are able to reduce sympathetic activation and by this reduce blood pressure in hypertensive patients.
What is this carotid body for?
So the carotid body 4 are basically there to regulate the level of oxygen and the level of CO2 in your blood by detecting when you are having a reduction of oxygen in the blood or an increase in CO2 in your blood.
But it's not dangerous to remove them?
Yes, it could be dangerous, but we have two sides. So the idea is to produce a unilateral ablation of carotid body in order to diminish sympathetic excitation and stimulate parasympathetic efferent activity towards the heart and the vessel, and you still have the other carotid body left to regulate and to do what these carotid body are for.
Kostas, you're an interventional cardiologist, and there's a new device out, actually, a mechanical approach to treat hypertension. Would you mind commenting on it?
Really, the last year we have published a study with an interesting approach to treat hypertensive patients. Just create a fistula of 4 mm between the iliac artery and the vein, put a specific small device for the being permanent in this fistula, and the blood pressure is reduced directly observed in the cathlab. This is a difference compared to what we have learned from, let's say, the renal denervation approach, where the blood pressure is reduced sometime after the procedure. In contrast to what Atul previously mentioned with the carotid interventions, in this method, the pathophysiology is not well defined. Despite that, we have observed a significant reduction in blood pressure in the cath lab that remained reduced during the follow-up of 6 months. Of course, we need more studies, larger sample, randomized trials to be sure about the effect of this procedure on blood pressure.
And side effects of that intervention?
The side effects are acceptable. There are some cases of iliac vein stenosis, but not so much, and they can be treated by putting a stent. This is something that we have to take into account when we plan the second study.
What do you think, who's the appropriate patient for such kind of approach?
At the beginning of this story, patients who were not responders to renal denervation was initially thought to be potential candidates for this method. At the present, maybe for any hypertensive patients who suffer from severe resistant hypertension, uncontrolled hypertension, despite the use of many antihypertensive drugs, it is one choice.
New approaches are currently investigated. The field is, research is pressing on in the field, and we look forward to new trials. that will investigate new concepts, new treatment modalities to bring patients with high risk to normal blood pressure values, and we are excited to keep you updated. Thank you for listening.